language they're using out there.
That's legalized marijuana.
I'm going to go out on loan. I think you might be able to.
You may as well join that group. They're pretty lots of smoke too. If you had a choice, you don't. You get 7 minutes left to go. You're leaving at 2:30, so it's 4 minutes before the wash goes out. It's like just you have here, because the noise will not proceed, will not making motions.
Well, Counselor, thank you for asking.
You know, it's too bad it's raining. I bet you they would have gotten a better turnout.
Well, we can't proceed it. We can't refer.
Sorry,
I can reschedule tonight. I will reschedule. I'm sure you're busy.
Also, because I'll just give up this. Plus, it's in my.
Where are you going?
Pinball Lakes in Barrie tonight.
Sorry, where?
Barrie.
I'll go to double check out.
I would go if I had nothing else to do.
Okay.
Lloyd, Councilor Whitehead's office has said, I guess he was, he's going to do his darndest to get here in 5 minutes.
He's here.
Is he?
He's watching.
Okay, here we are. You're welcome, Jeff. You're welcome.
Oh, jeez.
Okay, we now have
I apologize. I have to check my black face out now. I realize I was coming in for before.
Okay, I'd like to call this meeting to order. Members of the public are advised that our meetings are webcast live by the City Council and temporarily archived by the city's website. Other individuals in the media may also be audibly or visually recording this meeting. Madam Clerk, are there any changes to the agenda? Sorry.
There are no changes to the agenda.
I have a motion to receive the agenda as presented by Pearson, second by Conley. All in favor? Carried. Can I have a motion to approve the minutes of the April 1st meeting? Moved by Conley, second by Vanderbeek. All in favor? Carried. And there is one consent item, which is the changes to the Ontario Public Health Standards Safe Drinking Protocols. Are there any questions on it? Okay, so moved by Johnson, Brenda, seconded by Maria Pearson, that be received. All in favor? Carried. We have with us today Dr. Ted Mitchell, and I'll call upon him, the doctor, to present respecting a bylaw consideration for residential wood smoke. Dr. Mitchell, the podium is yours. You may have to speak up, Dr. Mitchell. I think there's a boisterous protest going on in the forecourt. Pulling a lot of smoke up there, I think.
That was bad. That was
So good, so good. Hello, everybody. 420.
Just 1 second, the clerk will turn the microphone on.
Is it? Hi.
There we go.
That's good. Yes, thank you everybody for coming. Happy 420. That's sort of ironic about my presentation here. So I am a family emergency doctor in Hamilton. I work actually mostly outside of Hamilton, however. And I've been always interested in public health items. anything that's kind of slightly outside of medicine. Anyway, I'm going to talk to you about residential wood smoke. If anybody recognizes this, it's the fireplace log on the Shaw cable channel. So you've probably seen this before. And a beautiful, warm, enticing fire. However, this has been reshot recently. Last year, they went to a cabin in BC to try to reshoot this in HD with all the latest everything, and ran into some problems. So the Globe reported that they had a lot of problems getting this thing to burn properly and cleanly. It smoked out everybody in the room a few times, and all the cameramen and stuff had to run for cover. They finally sent somebody onto the roof and to clean out the chimney. And it worked, so you get that lovely fire. However, note at the bottom, his coat is still unwearable with the stench of smoke. So to create one thing, you create a lot of side effects on the other. In the interest of public health in general, I'm interested in a bunch of things. One of them is longevity. So if you look at where people are the longest living, the healthiest and happiest people, there are a few places in the world that stand out. And of these things, if you look in the center there, you notice that there are, vegetarians, activity, etc. But they're not smokers, and they're very socially engaged with the community. Now, social engagement implies respect, and this is where I think our society falls down, and has been falling for the last couple of decades, unfortunately. So before this was even, nobody even really knew what my presentation was to be about. The media got hold of this, and then of course, you shouldn't really rely too much on the comments page or something, but this is from The Spectator. And so these are the kind of things that when you put yourself out as a physician to talk about something health related, this is what you get. And you have to have a little bit of a spine to do this, and I understand why most of my colleagues don't do it. However, the tide is changing a little bit. The Liberal government in Ontario put a regulation in January 1st of this year to restrict smoking on restaurant patios, in public parks, playgrounds, schools, etc. And it's somewhat interesting that we recognize that tobacco is a clear harm in terms of secondhand smoke, but something that is essentially equivalent in wood smoke in terms of the harms is pretty much unregulated, and it's almost like that across the country. So there are other physician groups that have tried to raise some awareness for this. The problem is bigger out west because a lot of people live in mountain valleys that have inversion conditions where the smoke does not disperse, it just sort of builds up, and there's a lot of wood around there, so that's what they burn. But it has been raised by other doctors, and I think slowly there is some education that's happening, but it's really quite a contrast between how we treat tobacco and how we treat wood smoke. So I've done a little bit of personal research on this, looking at some of the source documents. And I don't want to talk about this at length, but in any case, it seems to be, from my reading, that approximately equal risk for wood smoke and tobacco smoke, and other things too, if you're burning dung or crop residue, or coal is actually a little bit worse than wood. But many of the similar diseases, children have a risk of ear infections that just 2 or 3 times, even if they're within the household, not really outside effects of smoke, but just in a household that burns wood. Things like pneumonia, lung infections are all considerably higher risk. The risk for women with chronic pulmonary disease is actually possibly higher than that of tobacco smoke, which is interesting. And then there are a lot of miscellaneous effects, not to mention the nuisance effects, not just on quality of life, but nuisance effects on health. Because I can tell you as a physician who deals with patients, once a person has decided that they're sick, for whatever reason, and they've made a cause and effect relationship, whether it's legitimate or not, it is almost impossible to convince them otherwise. Now, why do fireplaces produce smoke? It's basically a lack of oxygen, and it doesn't get up to the high temperature where it can burn all the secondary products of combustion. So a lot of them go up in the chimney. Some of them deposit on the lining of the chimney, form creosote, and most of it comes into smoke, which is tiny little solid particles of various things. But anyway, if a lot of things that you can do, with these large damp logs, overfill the thing, burn things other than wood, and just let it smolder all night. And this is the main causes of the smoke. You can go to something like natural gas, and one letter of the paper said that everybody's going that way anyway, and they are because it's so cool, it's convenient, and click, and it's clean and lovely. Another way is the certified stove. Now, that theoretically is 10 to 20 times cleaner than a standard stove because of the way it recirculates the gases and burns it hot. However, it's very dependent on the age of the thing, the operator, what fuel they use, maintaining it. So in the real world, it's only maybe about 3 times cleaner than an uncertified stove. But the interesting thing there is look at the size of the wood stove ones compared to gas. This is really huge. We're talking like very many orders of magnitude, 1,000 times or more difference. The problems with having a bylaw, I think a lot of municipalities have run into this, are if you just license a certified stove, as many small municipalities have done, they've seen improvements, don't get me wrong, but over time, it doesn't seem to live up to the promise that it did earlier. It's difficult to enforce potentially, and of course there is the momentum of tens of thousands of years of history. We came from cavemen who fire was really the reason we're here. So if you say, how big is the problem? Sorry, I don't have a pointer here, but anyway. I live in the middle there. There are 1, 2, 3, 4 houses within 100 meters there that regularly impact this local environment. So if you take the worst Sorry. Okay, that's all right. Anyway, that one does impact mine, and there are about 40 houses. This is a low density, fairly rich neighborhood. And so you're talking about 40 people who are impacted by that one house. So basically, if anybody in that picture is using a wood stove, you know it. You can smell it on the air. So if you're looking at the rights of somebody to burn wood versus the rights of people to do things like open their windows at night and hang laundry, it's not really one person versus another. It's one person versus 40 or 50. One of my favorite bike routes is in the Dundas Valley. At the end of Artaban Road, there's a bell remaining where there was a camp. And the only thing you can read with the area leveled is this inscription that's fading. It's from the Bible, from Proverbs, I believe, where there is no vision, people perish. Now, thank you so much for signing the document, the Blue Dot document, 2 months ago. And it commits the city to clean water, fresh air, safe food, sort of motherhood and apple pie things. But that has to mean something. And I think to do something about this, instead of making, like Ontario, Canada, we have this bad habit of punishing everybody for the sins of a few. And it's very inefficient and it's very unfair. So what I'm asking you to consider is to target the worst sources and try to do something to eliminate them for social justice, for quality of life, and for health. I won't get into the details of what those are because that's in another document, but thank you for listening.
Okay, thank you, Doctor. I've got questions, Councillor Whitehead.
Sir, I'm raised in Northern Ontario, have 2 fireplaces upstairs and downstairs, and probably a much higher number of households used wood and fireplaces to supplement the cost of heating their homes, especially with the type of winters that is sustained in northern Ontario. And burning wood has been a supplement for heat for the dawn of time. So it is a bit of a cultural shift to move people away from that whole philosophy. When I talked about the urban setting, I did meet with public health several years ago because I had complaints regarding the neighbor and possibly the smoke attacking their neighbors, and whether there's any bylaws currently in place. At that time, it was zero across the country. The second piece was I asked for, is there any evidence-based information at that time? And there wasn't a lot out there. So I guess that was probably about 7 years ago now that I think I first started looking into this. What has changed in 7 years?
There's probably at least 100 times more science on tobacco smoke than wood smoke, and that's strictly cultural. I mean, it's not. If you look at the list of thousands of substances that are in one and the other, and you said, what's your best bet? Are these things one more dangerous than the other? I think your best bet that was within a factor of 10. It's safe to say that they're the same thing. So, I mean, if you have to prove that in terms of a court of law, that's taking the assumption that it's not harmful and saying you have to prove that it is. Or you could take the precautionary principle and say, you shouldn't be doing anything until you prove that it's safe. Or, as I favor, you can take sort of a middle of the road and say, if you had to bet your life on this, what would you bet? And I would bet that within a factor of 10, wood smoke and tobacco smoke have essentially similar health effects. And so there have been, Montreal actually is going to potentially a full ban in a little segment of it. There's a population 8,000 little borough of Montreal where come this November, all wood burning will be illegal except for pellet stoves, which are very clean burning. And the city of Montreal in total, the large one, is looking, since 2009, it's been illegal to install any kind of appliance, even clean burning ones. And they're looking at what kind of standard they can agree to. There's a number of sort of more minor restrictions in all the little towns in BC. But there's a lot of draft documents out there from the feds, from the province, that sort of, to me, it says that the doctors and the civil servants that have looked at the health effects of these things have said, this is kind of bad stuff. You should do something about it, but our bosses don't have the guts to do it. So here's the document. Here's some options, and sign here. But then municipalities think that, well, this is something bigger than us, and it's really not our rights to say it. And so it's something that really falls through the cracks. So for somebody living, right next to a bad, regular, conventional fireplace user, that's their main source of pollution. It's not the Pasco. It's not.
I appreciate it. I think the difference, though, is that with cigarette smoking, there isn't any real benefit other than somebody enjoys smoking versus people that burn wood in their homes are reaping a benefit of reducing the high cost of energy in their home. So I think I don't think you can compare the two from that perspective. And that's why the cultural shift would be much more difficult dealing with fireplaces.
Do you know what? That's what people say, but in my neighborhood, I kind of know a lot of these people, and only one of them is doing it for heat. The other 9 or 10, it's on at 7 p.m. It's ambiance. It's only that. And the other one for using wood for heat, it does save you a little bit of money, but unless you're out in the country and have free wood, not a lot.
I appreciate that. I met with the fire department, had them actually attend the home that was in question. It was creating a problem with the neighbor to ensure that all the codes were being met in regards to the chimney height, etc. In that case, it was determined it was. So I guess my question to you is, do you see through regulation and building codes things shifting, or are you looking just at an outright ban?
they tolerate a whole bunch of stuff. I mean, I look outside my bedroom window and 20 feet away is my neighbor's fireplace, the top of the chimney. And that meets all codes. And of course it would be grandfathered, so there's nothing you can do about that with building regulations. And yet that's a really serious source of pollution. So I think that the thing to do, the two proposals are bylaw 2002-283, which is a law in Hamilton right now, has a section 4.2, which means that you can burn anything in your backyard as long as you're cooking with it. And it really has, it makes the bylaw essentially useless. And so I think that emergency use, lovely, your power's out, absolutely, make a bonfire in the backyard and cook something. But otherwise, you're making it so that dozens, maybe hundreds of your neighbors can't open their windows at night without the smell of smoke. And the cost of, air conditioning and electricity, I think that completely blows it out of the water. So that's not a heating problem. You can't make the excuse that that's for heating. It's just totally for ambiance.
Sorry, just a correction. I mean, you're talking about an experience that you have in a neighborhood, but to suggest that it's not within the parameter possibility that people are utilizing fireplaces to offset their heating bill would be somewhat naive.
Would be somewhat
Naive to suggest that there are people that do not use their fireplaces. They're not using their fireplaces to supplement their costing of heating their home.
Oh, I'm sure there are. In my neighborhood, it's a very small percentage.
Fair enough.
It's
I just want to make sure that's the argument that we would be.
However, does that give you the justification to harm the neighbor's health? If you have no neighbors, it's not an issue. We're not looking to ban anything. It's really just to have the nuisance and health effects of the smoke addressed.
I want to be clear that I support something. I get a number of complaints in my own ward. I was giving you sort of context and cultural shift and challenge that we will have as a council, because if that argument comes forward and they make the case that affordability is an issue and why they do it, it's going to be an issue that will carry some weight in regards to a go-forward position. But I just thank you for at least starting the dialogue. Thank you.
Okay. Councillor Jackson.
Thanks, Mr. Deputy Mayor. Thanks, Dr. Mitchell. Nice to meet you. I'm sorry about the initial remarks you received. Welcome to our world, but I'm being a little bit facetious. But anyways, Doctor, unlike Councillor Whitehead, quite frankly, I don't recall that I've received any complaints whatsoever. So I want to make it clear. You're not talking about gas or electrical heated fireplaces or barbecues, Mr. Deputy Mayor, through to Dr. Mitchell, correct?
Correct, not barbecues, no.
No, or fireplaces that are electrical or gas?
No, those are essentially zero emission from the standpoint of human health effects.
Perfect. So something like I had in a home on Albion Falls years ago where I had, it's called LOPI, a low-pi stove that stuck out from the fireplace, but I put wood in it. But I was able, of course, to close it, enclose it, went up through the chimney. That's the type of thing, Mr. Deputy Mayor, through to the doctor, that you're getting at, that you feel is harmful both for the family living inside and for possibly neighbors on the outside?
Well, depending on where you draw the line, I think any kind of wood heat is harmful. But showing you the picture of my neighborhood there, if there's the 9 or 10 people who use conventional stoves, they're a big problem, even though the one who uses an advanced certified stove is burning more often than almost all the rest of them but combined. But it's the least problem because it's a certified stove and he burns it fairly well most of the time. So I have to say that when you smell that smoke, it smells like wood. It doesn't smell like ash or creosote or some other kind of toxic stink. You can actually tell they're burning wood. All the other ones are just horrible. They're not as frequent, but they're horrible.
You know the romanticism side of a wood-burning stove and resorts that allow me to carry on with this.
I think this is a very important point,
Thank you.
Jackson.
I thought it was. I won't get into more intimate details, but
What type of wine?
but the romanticism of the wood-burning stove, the resorts that my wife and I have been to over the years, the outdoors aspect of it, and for my colleagues who represent rural areas, can't see how there's going to be acceptance of eliminating the ambiance, the enjoyment, if you will, of the warmth, as well as of the pleasant viewing of and being part of the enjoyment of life's experience that way. And all kidding aside, Doctor, through you, Mr. Deputy to Dr. Mitchell, any comment on that regard?
I'm from Northern Ontario and have burned a lot of wood.
Dr. Mitchell, can you get right up to the microphone more? We're
Sorry,
having
yes.
difficult time hearing you.
Okay. Being from Northern Ontario, we have a lot of experience burning wood. I know exactly where you're coming from. And in the true rural areas in Hamilton, I really don't think this is an issue because it's not meant to be, buy this appliance and be compliant with a law type thing. It's a nuisance smoke on your neighbor's bylaw. So if you and all your neighbors burn and you don't care, then that's not a problem. The thing is, if there's one person and 100 people who don't burn in a denser part of the city, then the negative effects of that just vastly outweigh any of the positives. And you can get all the ambiance and stuff with a gas fireplace.
So I'll just quickly wrap up, Mr. Deputy Mayor. So Dr. Mitchell, I guess we should, after we hear as well from Dr. Lukasik, who I believe is speaking on the same matter after you, I would imagine we'd want to not only receive, but maybe refer this to our MOH, Mr. Deputy Mayor, for further study and report and comment back. Do you remember a Dr. Goodyear back in the 80s, Dr. Mitchell?
I don't.
Okay. My goodness, I've got a few more years on you, man. Okay. Anyways, well, a Dr. Goodyear, real fast, Mr. Deputy Mayor, he led the fight. He was one of the first ones locally who talked about the anti-smoking campaign, the anti-tobacco, and he did it under the premise of the secondhand smoke is maybe even more harmful than even somebody who smokes regularly. A lot of skepticism, a lot of cynicism, a lot of suspicion, a lot of doubt. I, as one citizen, before I became on council, and then since being on council, kept an open mind. Restaurants, I mean, think about where we've been years ago. You could smoke in the theater, smoke in an airplane, smoke in a restaurant, didn't mind that smoke, wafting over your the next door at the booth there with people being non-smokers and walking into their steaks and their food, etc. So eventually, tremendous community and societal buy-in against the anti-smoking and against secondhand smoke. I see this, I'm willing to keep an open mind, but I'll be honest, it's not necessarily for top priority for me at this time, Doctor. You're the first one I can recall that's come in to speak on this issue in a public forum, unless I missed it over the years. I definitely need a lot more information. I'd love to have town hall meetings on it, with possibly somebody like you or Dr. Lukasik down the road. I kind of see like the fluoride issue right now, which is kind of like it could go either way currently, and some of us have waited for more statistical evidence than that. So, Doctor, it's, again, just saying sincerely, thanks for coming in. Not high on my priority list. I don't see a major pushback from the constituency I represent, but at least worthy of some more conversation. Okay?
Thank you.
Thanks, Mr. Deputy.
Thank you, Mr. Deputy Mayor. Certainly, thank you, Dr. Mitchell, for coming in. And I guess I'm going to be on the other side of this because I do have a wood burning stove, and I do heat my house with it, and I live in the urban area. And you say that would be very, unequivocal or questionable whether I do or don't heat. I can tell you for a fact that in the fall I don't put the furnace on, and there's been years that I haven't put the furnace on until January, February. So I have heated my home with the wood burning stove. It is a large stove. It does accommodate large logs, and it is run efficiently. I don't allow, and a lot of the issues I think you have with people that may burn, I've never had, I will be honest, I had one complaint of a wood burning appliance that was in a garage. It was secondary, so it was a lower chimney, and addressed it with the neighbor who was creating the problem, and it was resolved. But I can say without a doubt that I have it, and I'm not sure if everyone around this table is aware, but as a home with wood burning appliances, you are also subject to an increase in insurance rates, because they make darn sure that they know you have that, so you make sure you follow all the rules and regulations. I just wanted to question them because it seems strange when I was seeing the pictures you were showing of, open windows and hanging laundry out. I would say for a fact I don't burn my wood burning stove inside. So I'm not sure when that's happening, but I don't see that happening in my neighborhood. And I would say if I had to drive home today and start taking account of how many wood-burning appliances are in my area, there are quite a number. And on top of that, I think we should all be cognizant of the fact that we have an awful lot of ash trees that are coming down now. And yeah, I do have a source of free wood. I have 11 ash trees personally on my own property, and I'm going to be paying to cut them down. I certainly hope that I can use them to burn in my wood stove. But I appreciate where you're coming from, and I don't know if this is directed to staff today. If there's a way of dealing with the issues that create the nuisance, that be the problem, because I've never created a nuisance. I have no nuisance issues in my ward. So I just wanted to put that out there today, Mr. Deputy Mayor, and I appreciate where you're coming from, because there are some people that just aren't educated on how to make sure that it is working efficiently. So I thank you.
Okay, and Dr. Rich, just for clarity purposes, in case this does get referred to staff, just so I'm clear in your ask, you're not asking that we ban all existing fireplaces, possibly a grandfathering. Are you focusing on fireplaces or rear yard fire pits?
I think the major thing to me, sorry, I should not use the word no-brainer, but I think the fire pits in the summer create way more like...
So anything that has no chimney to take the smoke up?
Yes, exactly. And none of those are used for heat. There's really no justification. And as temperature goes up, the effects of any kind of pollutant go way up. It's kind of exponential.
Do you think it's more serious with certain types of fuel, i.e. railway ties, which are creosote soaked, or pressure treated lumber? That's kind of bigger issue for you?
You really don't know that those things are there. I mean, there's no safe disposal method for the copper, chromium, arsenic, green, pressure-treated lumber, for example. If you bury it, that's not really safe either. They've made this stuff and they don't know what to do with it. So, but if you burn it, holy cow, your kids could have serious neurologic problems.
Okay, motion to receive. Moved by Pearson, second by Vanderbeek. All in favor? Carried. Thank you. And now call on Lynn Cassick to come down. This is regarding the same issue.
Good afternoon. Thanks, Chairperson Ferguson and members of the Board of Health. I really appreciate the opportunity to come and speak to you today. And I'm really here as a representative of Environment Hamilton to support Dr. Mitchell in the efforts that he's made to raise awareness about the human health implications of burning wood smoke. As you know, my organization has worked for many years now on local air quality issues. You won't be surprised to hear me say. And residential wood burning can really become a serious air quality problem if it's carried out in an irresponsible manner. And I think that's the concern that we have. Dr. Mitchell has highlighted the potential for human health impacts, particularly in residential areas in our city where homes are in close proximity to each other. So we believe that irresponsible burning of wood and other waste materials in a residential setting requires swift attention and resolution from those with authority to take action for the following reasons. The smoke generated by fireplaces and stoves is being released into residential areas where the potential for human exposure is very high. Emissions are often from chimneys or stacks that are generally short and lower to the ground, so 2 stories and often less. And the emissions are largely uncontrolled. You know, a typical fireplace or a backyard shed with a chimney where someone's burning has no pollution control on that stack. And the contaminants can include fine respirable particulate matter, and that's a big concern, as well as volatile organic compounds, PAHs, cancer-causing dioxins and furans, nitrous oxide, sulfur oxide, carbon monoxide, and carbon dioxide. So you may be wondering, what are we hoping you can do about this issue? So there are a couple of specific asks that I have from Environment Hamilton. At the most fundamental level, we'd really like to see Hamilton Public Health raise public awareness about the challenges associated with wood burning, especially if done improperly in populated areas. And I just want to point out to you that you really don't have to look far to find examples of public health departments that have taken action on this issue. And I have a two-pager that I'm just going to hand to all of you now to take a look at. This is from Halton Region.
Madam Clerk, do you want to pass those out?
And I think Halton Region has done a really nice job here. And again, you'll note they're not banning wood burning, but they're raising awareness. They're helping people to understand that there are human health implications and air pollution implications from burning. And I really appreciate the fact that they highlight that, you know, if you have wood smoke in your home, there are impacts for you and your family, but they also point to the fact that there are potential impacts on your neighbors as well. So I think the approach that they've used here is one that's worth taking a look at. And I found other good examples. Peel Region has some great information as well. So when you go to the public health section on the website, they've got a whole page with information and resources like this that you can download. So while many will argue that it's only a minority of neighborhoods that are impacted by irresponsible burning practices, and that's true, the reality is that the problem does exist in every community, including Hamilton, even if on a small scale. But as Dr. Mitchell has pointed out, even one problem on a small scale can impact a lot of people. And I should say that after that recent media coverage on this issue, Environment Hamilton heard from a number of Hamiltonians. I heard from 4 people who I talked with who shared with me their ongoing struggles with irresponsible burning in their own neighborhoods. And all of them expressed concerns about the impact on their health and the health of their family, the inability to open windows in warm weather because they were having experiences with burning happening year-round. In one instance, even in the wintertime, the smoke was so bad that kids weren't going outside to play because of the smoke. So here's the challenge. People who were experiencing these kinds of impacts, and I would emphasize from situations where it's irresponsible burning, people just not doing the right thing, either because they're not educated on how to burn properly or not doing proper maintenance. The people being impacted had an incredibly frustrating time getting any relief. And the one gentleman I talked to told me in detail a story that went on for months and months to the point where it was several years before he did see any relief. And it wasn't an easy process for him. So I just want to give you a quick sense of generally what seems to happen when people are faced with a problem like this. And I'll be honest with you, I'm speaking from personal experience as well because I've struggled with this issue in my own neighborhood. So a neighborhood could be burning regularly, year-round. In my case, it was in a back shed. And based on smell, you wonder whether they're burning wood all the time or other things that they shouldn't be. And if you try to talk to your neighbor and get the problem resolved and you see no relief there, you have to start to look at other ways that you can see the problem resolved. So you might call the city to ask whether anything can be done. And often, if you call the general line of the city, you'll be directed to the fire department's fire prevention program. And they'll ask you questions to find out whether it's outdoor burning that's happening, because you do have a bylaw that speaks to that issue. But when they are told that the issue is indoor burning, the best advice that they give is that you call the fire department when the smoke is really bad. So if you do that, the fire department sends a truck to talk to the neighbor. And I've been told that generally the practice that happens then is that the firefighters will look at what's being used for burning. They'll make sure that it's to code, and if they're good and thorough, hopefully they'll be asking questions about a clean wood pile. But often they don't do anything more than that. So you're left potentially with, even that same day, the burning continuing. Some people contact the Ministry of Environment and Climate Change because they figure it's an air quality concern. The ministry may send someone to check out the situation, but I can tell you it's pretty much the same sort of challenge to get them to act on these sorts of residential smoke emission problems as it's been to get them to act on visible industrial emission problems. It's not a straightforward, easy solution. So I guess the second ask that I would like to make to the Board of Health is that, fair to say we believe that the current system is broken when it comes to swift resolution of the extreme problems. So our second request today is that the Board of Health initiate an effort to bring the various players together, including representatives from the city's bylaw department, public health, the fire department, and representatives from the Ministry of Environment and Climate Change, just to gather around the table and talk about this issue and the role that each entity plays in responding to community calls regarding irresponsible burning. And we're hoping that maybe a better understanding amongst all players could only help and result in better approaches on the ground. Because again, I would say for people who are being impacted by this, it's not a fun situation. And I would add here that if we as Environment Hamilton could help in any way, even in just sharing the stories that we've heard, we'd be happy to do that as well. And I envision, the outcome of a stakeholder gathering like this would be even just a simple step-by-step protocol or guidance for community members, so that when they're encountering this kind of problem, they know the kinds of observations they should be making or questions they should be asking, and they know who to call, because right now it's a huge problem for people who are faced with this situation. So just quickly in closing, I want to say please consider the need for public health to develop some effective public outreach materials on residential wood burning. And I think there are some great examples out there, so you wouldn't even have to reinvent the wheel. And then additionally, please consider enlisting public health to facilitate a coming together of the various players to discuss each other's roles when responding to this problem and figuring out a better way forward. And please, do this for the sake of those who find themselves struggling for months and sometimes years with this problem. And even if they are a minority of people, it's a challenging problem for them with potential health implications. Thank you.
Thank you. Councilor Wade.
Thank you, Linda. I think the first start is to deal with the open wood burning in backyards in an urban setting. I think the loopholes that you're cooking on it, with all the options you have to cook outside, I'm not a big fan of the open wood burning. And often, I know I get a lot of complaints in my ward. Often, when the fire truck shows up, they throw a hot dog on just to justify the wood burning. So it's not an effective bylaw currently in any space. So that would be a first place where I'd be prepared to start the discussion. I have had complaints 7 years ago on Cranbrook. I had the same process you talked about. I brought the fire department in to make sure everything's to code and so forth. And one of the things the fire department told me is that more efficient burning could help facilitate this issue. So I don't think we have regs on inspections on chimneys and fire sweeps and those kinds of things that could help to some degree. I mean, obviously not eliminating it, but every step towards a healthier burning of wood is best for everybody. So the reason I asked the doctor earlier about looking at regulations, it wasn't about eliminating, but it was about tightening the rules around wood burning in the context of fireplaces. The other issue that you didn't address, and I'm glad Councilor Pearson mentioned it, I got chronic burners that are going out picking up all the ash tree woods that our trees will be taken down and chopping up and bringing the wood to the yards. Well, now I got issues where you got homeowners that have taken the wood and basically on both sides of their budding lots are all this wood storage. And of course, with wood storage, it creates a rodent issue. It creates other problems for the neighbors as well. So there's another issue that no one's really talking about, and that is how the wood is stored, how much wood can be stored legitimately without impacting on your neighbors. So I think that's another area of regulation we need to consider. So thank you very much.
Councilor Jackson.
Thanks, Mr. Deputy Mayor. Thank you, Dr. Linda, for coming in. I think your two requests are reasonable. I'm happy to, after we receive her presentation, Mr. Deputy Mayor, move the information outreach, similar to what Halton has, pending, of course, our MOH suggesting otherwise, and or that they may already be doing something similar, and the all players type of conversation around the table. I think that's prudent. I think that's a good starting point as well. Dr. Lukaszuk, I see here with Halton, they do not currently have a bylaw regulating indoor wood burning. In spite of the great outreach, do you suspect that's because the outreach is effective and getting desirable outcomes? Or do you feel there might be some timidity with the regional government from doing that last more enforcement step? Through you, Mr. Deputy Mayor, please.
Yeah, that's a good question. And I thought that there were elements of their handout that were pretty strongly worded in terms of raising awareness about the dangers of wood burning. But you're right, they haven't called for a bylaw, although I don't think they've closed the door. So I haven't talked to anybody at Halton Region, but I would imagine that they're hoping that this will go a long way to resolving the problem. And as Dr. Mitchell has pointed out, rather than going that route of clamping down on everyone because of a few, I imagine Halton may be using a similar kind of approach, hoping this will do it.
And like Dr. Mitchell said, in emergency extreme circumstances, power outages, whatever, do you see kind of like a backup role still for wood burning, Mr. Deputy Mayor, through you to Dr. Linda?
Sure, I don't think that's unreasonable. I grew up in a house with a fireplace, but I'll tell you, it was changed out because of allergy issues in the house. But I think that is a fair concern to raise, especially as we have lots of uncertainty with weather as we move forward.
Do you remember Dr. Goodyear, or have I got a few years on you as well?
No.
Dang. Anyways, Dr. Goodyear did good work at the end of his time with regards to the secondhand smoke campaign. Thanks, Dr. Linda.
Okay, no more questions, so a motion to receive both presentations. Whitehead, Jackson, all in favor? Carried. Thanks, Linda. So, Councillor Jackson, you got a motion you want to make?
The two asks from Dr. Lukasik on behalf of herself and Dr. Mitchell, I'll forward those, or move those to public health for comment.
Can you just repeat those two are so it's clear for the staff?
Number one was the outreach campaign that Halton has done. Unless Dr. Richardson has a comment on it saying, look, we're already doing it, Councillor Jackson, or whatever. And secondly, about the all players meeting that Dr. Lukasik suggested, fire, bylaw, public health, all getting together and maybe starting a conversation.
Okay. Dr. Richardson, any comments?
To you, Mr. Deputy Mayor, that's fine with us in terms of coming back from the campaign. We can do that easily, and then we can come back and talk about the process of meeting around the bylaw.
Okay. And yes, Councillor Johnson.
Very, very quickly, to Dr. Richardson, through you, Mr. Deputy Mayor, if any kind of recommendations are generated, I know that our Hamilton Fire Department has been doing some really good work speaking with First Nations communities in Hamilton around the particular uses of fire by urban Aboriginal people. So I'd like to make a statement, any rules or recommendations about new fire rules, please take specific consideration of that one community's unique situation.
Thank you. And Councillor Jackson.
Dr. Richardson, if I heard your comment at the end, in my motion, I hope you didn't misinterpret. I wasn't necessarily referring to you coming back with a suggested bylaw at this time.
Correct.
Mr. Deputy Mayor, through you to Dr. Richardson, just to be clear.
Through you, Mr. Deputy Mayor, yes, thank you for being clear. And so that I'm clear back, we can do the campaign without further bringing that back. We just go ahead and do that. On the issue of bylaw, we would bring back a process for comment. We wouldn't start.
Sorry, Dr. Richardson.
Go ahead, Rob.
My two-part ask, which I thought was well noted from Dr. Kasich, was a Halton region type of outreach. And I'd like to see that coming back, by the way, at a future Board of Health, Mr. Deputy Mayor, to see what our outreach and the information we're providing our community looks like, if you don't mind, in courtesy. And secondly, her second ask was to start a conversation with your department, MLE, fire, and any others appropriate, to start a conversation and then maybe give Board of Health in a few weeks or a few months an update on how that conversation's going. Through you, Mr. Deputy Mayor, to Dr. Richardson, so she's clear, please.
Dr. Richardson, are you clear on that? You would like, Councillor Jackson, you would like the Board of Health to bring this back to us?
I would, but without, at this time, talking at all about a bylaw.
I see nodding heads over there.
Thank you for the clarification, yeah.
Thank you.
Can I just get the chair 1 second, Councillor Whitehead, and I'll support this, but I want to go on record right now. I'm not supporting the banning of fireplaces. I think a lot of people have worked very hard to get their dream house with a fireplace in, to have that romantic Saturday evening with a fire and a bottle of wine. And I'm not about to start to take that away from anyone. But I do understand the backyard barbecue, but only in urban areas. I don't think this needs to cascade down to rural areas, because it's a different environment in the rural areas, and there is no natural gas available in rural areas, so they have to depend on wood-burning fireplaces. So I hope, Dr. Richardson, you just focus on urban areas when you come back. And I'm with Councillor Jackson, no bylaw at this time, because, and I think wood-burning fireplaces are essentially being grandfathered now. There's very few new homes that builders are building with wood-burning fireplaces. They're all being built with gas fireplaces now in the urban areas. So essentially, wood burning fireplaces have all been grandfathered already. So those comments, take the chair back. Councillor Whitehead, you got a comment?
Yes, just a couple things. One is, I'm not sure if it's, in practice, I agree with you, but if the homeowner requests specifically for a wood fireplace in the new home, the question is whether or not it's prohibited under the current rules, and I think it is.
I don't think it is.
Well, that's what it is. Okay, so that's why I asked about the building code, because I don't mind grandfathering what's there, but moving forward, we could prevent more wood fireplaces being built in an urban setting. I could support something along that line. I just don't want to take something away from somebody that's had spent big money buying a home, and one of the attractions was that particular amenity. The other piece I would ask for public health and maybe see that'll be under planning with bylaws, is I'm getting a little concerned about the number of houses, because again, the amount of trees we're taking down, available wood. There's a lot of hoarding going on in regards to wood, and I don't know what the rules are in regards to how much you can put in your actual on your property. But it is concerning to me that if it becomes problematic in regards to roads, etc., especially we got rules in regards to air conditioners and those kind of things outside yard lots. Now we're allowing all this wood to be piled up against a fence all along the way, the length of the fence on both sides of the home, butting other people's property. It's creating, again, an issue and concern with those abutting properties. So I wouldn't mind them looking at that and seeing if there's for regulations, but it's an information report. Other communities doing anything to address that issue.
Okay, no more speakers, so it's been duly moved and seconded. All in favor? Carried. Opposed? The motion carries. I'd like to move on to 7.1, which is the Board of Health orientation. I'd like to call on Jennifer Hall, Business Initiatives Lead, and Jen Vickers-Manson, Program Manager, Reproductive Health and Early Identification, to provide the next presentation in our Board of Health Orientation Series, Ontario Public Health Standards. Welcome, ladies.
So thank you for having us here today for your 4th Board of Health orientation session, and for participating as the Board of Health in all previous orientation sessions. Today, myself and Jen are going to speak to the Ontario Public Health Standards and provide an overview and how it impacts the work we do at Public Health Services, as well as the direction that you provide as the Board of Health. So the Ontario Public Health Standards are a set of regulations published by the Ministry of Health and Long-Term Care that direct mandatory public health programs and services in Ontario. The legal authority for the OPHS is established in the Health Protection and Promotion Act, which is our primary legislation governing public health units in the province. The development and introduction of the OPHS in 2008, at the time, was the first comprehensive redevelopment of guidelines for mandatory programs and services in over 10 years. So I'm just going to bring you your attention to the Department Operational Work Plan approach at Public Health Services, and I know you've all seen this through previous budget and orientation presentations. But it's important to understand the role of the Board of Health under the OPHS, not only because it's enforceable by the Health Protection and Promotion Act, but also because you'll remember that most of our staff's time, energy, and resources falls into that large bucket of work in the bottom right-hand corner of the screen. That's our PHS usual business. And that work is all the work that's involved with taking the OPHS and putting it into practice. So it's a large body of our everyday work at Public Health Services. So this is a visual representation of all the components of the OPHS, and I'm going to use this diagram to provide you a little more detail about each piece. So if we start at the base of the diagram, the OPHS is actually rooted in 4 key principles. So the principle of need addresses using local data to tailor local programs and services to the unique needs of the community, also taking into account determinants of health and inequities, and I know that was presented to the Board of Health at the last orientation session. The principle of impact considers the effectiveness of public health programs and services, And the principle of capacity addresses the ability to deliver these programs and services based on human resources, information resources, and financial resources. Finally, the principle of partnership and collaboration focuses on developing community capacity in both the health and non-health sectors. You'll remember that Public Health Services for 2015 has a PHS priority of health system integration, and this focuses on continuing to build these strategic relationships with our community partners. So keeping those 4 principles in mind, the OPHS builds upon them a foundational standard. And the foundational standard ensures that public health programs and services respond to changing needs in the environment, as well as contribute to the public's overall health and well-being. Action items and direction within the foundational standard can fall into one of 4 categories. So they're listed there as population health assessment, surveillance, research and knowledge exchange, or program evaluation. And all of these areas ensure that public health programs and services are informed by evidence, as well as contribute to a public health knowledge base that allows us to continually improve our programs and services. So finally, we have the program standards, and these can fall into one of 5 key areas. So they can fall into chronic disease and injury, family health, infectious disease, environmental health, or emergency preparedness. Public health units are expected to plan, deliver, manage, and evaluate programs and services within each of the standards in these 5 key areas. So if we take a little deeper look at each of the standards, each standard is comprised of a goal, societal outcomes, Board of Health outcomes, and requirements. So the goal statement for a standard is the broadest or highest level of results to be achieved. So for example, if we use chronic disease prevention, the goal statement is to reduce the burden of preventable chronic disease of public health importance. So each standard also identifies societal outcomes that are intended changes in either health status, organization, systems, or environments as a result of the work that's done within the standard. Each standard also has a list of Board of Health outcomes that are a result of the endeavors by the Board of Health. And this can be intended changes in attitudes, awareness, knowledge, or again, environments and policies. And finally, each standard has a series of requirements, and these are provided with the most detail and have specific statements of action. So in order to provide greater direction to operationalize the OPHS, protocol documents were developed, and these are program and topic specific documents, and they help to standardize services across Ontario. Some of the protocols also have additional guidance documents that can further support service delivery. So all of the components of the OPHS, including the protocols, are enforceable under the Health Protection and Promotion Act. Some guidance documents are also enforceable as well, whereas others are just additional information for service delivery. So I know you won't be able to see all the information on the slide here, but this is a snapshot of the Family Health Reproductive Health Standard. And we just wanted to include this as we wanted to show how complex a standard could actually be. So this standard goes well beyond what is shown on the screen. There's actually additional Board of Health outcomes, 7 detailed requirements, and 2 supporting protocols. So given that level of complexity, I'll let Jen explain to you how we actually put the OPHS into practice at Public Health Services.
Thanks. So as Jen suggested, I'm just going to give an example of what the protocols and standards look like when they come to life in relation to the Family Health Program standard of the Ontario Public Health Standards. So the Healthy Birthways Initiative is one example of work that Public Health Services plans and directs to fulfill the Ontario Public Health Standards. You can see here on the screen, the goal of the reproductive health standard is to enable individuals and families to achieve optimal preconception health, experience a healthy pregnancy, have the healthiest newborn possible, and be prepared for parenthood. I'm going to give you a high-level overview of the Healthy Birth Weights Initiative and outline some of the work that's been completed in order to fulfill some of these standards and protocols. As a reminder, in January of 2014, Dr. Hamida Magani came with an information report about the Healthy Birth Weights Initiative, and we were here in June of 2014 with a recommendation for the extension of our temporary project manager, Vanessa Parlett, who's with us here today. Just to set the historical context of this issue in the City of Hamilton, I wanted to remind everybody here today of the Hamilton Spectator Code Red Born series that highlighted low birth weight as an issue in our city. In this chart, you will see data broken down by broad neighborhood level, and in some instances, it was easier for us to name the neighborhood itself. The entire City of Hamilton is not represented on this chart. We wanted to be able to show you the areas with the highest percentages and the lowest percentages. If we included all the data, the chart would not be legible at this point. Looking at the data and analyzing it allows us to see the specific needs of our community as it relates to population and specifically the determinants of health and inequities in our city. If you look at the top of the chart, you can see the 5 neighborhoods in our city that have the highest low birth weight rate. These neighborhoods also rank in the top 5 or 6 for smoking during pregnancy and teen pregnancy. For low income, the top 5 neighborhoods also rank among the top 8 communities in our city compared to the city average, which is in the yellow bar across the middle. At the bottom of the chart, you see the areas of the city where low birth weight rate is lower, and we also see higher incomes and much lower rates of smoking during pregnancy and teen pregnancy. The data is so low for the teen pregnancy rate in those areas that the data is suppressed at this level.
Question on that though, Jen, just go back just so the committee understands it. Are every one of those numbers percentages?
Percentages, yeah.
Okay, so as an example, look, 19% of the population of Ancaster is low income?
That's right. No. So let me just refer to my project manager, Vanessa Parlett, to help clarify that data there.
Through you, Mr. Chairman, those are actually rates per 1,000. Does that clarify?
No. Yeah, maybe the rest of the committee does. I'm just trying to get this clear for the committee because I'm not trying to ask personal questions. I'm trying to ask on behalf of the committee. So rate per 1,000.
That's the number of individual per 1,000 individuals.
Which is pretty much the same as a percentage. It's the same type of information, so not.
The percentage representation would be a representation of the entire population. Oh, sorry, I'll let Jessica speak.
Thank you.
I'm Jessica Hawkins, one of the assistant medical officers.
Can you get rid of the microphone because you can't hear
Yeah,
you?
sorry. So when you're looking at these data, one of the first things that you should keep in mind is this only applies to pregnant women. So this isn't the entire population that we're speaking about, but just pregnant women in each of those areas. And when you have a look at that, so if there are 1,000 deliveries, and clearly there are not 1,000 deliveries occurring in each of these areas, but if there's 1,000 deliveries, 8.6 of those in the stadium district are going to be low birth weight. So overall, this isn't the percentage, and we can get you percentages if that's something that you're looking at, but this is one way to look at the data and allows you to compare between different groups when there's very small numbers of deliveries.
Okay, just for information purposes, that needs to be labeled so you understand that. But it's, because I couldn't understand what those numbers were. Councillor Jackson, you had a question on this chart?
Could I, because you had one on the
Yeah,
slide.
please.
So I don't understand why certain geographic areas of our city were left out. Dundas, Stony Creek, Bimrock, West Mountain, Central Mountain. I don't understand why. Somebody explain that to me, please.
Through you, Mr. Chair, to answer your question, we do have data broken down by the entire neighborhoods in the city of Hamilton. To present it on one chart would be illegible up on a slide. We can get that data for you. I just wanted to highlight why low birth weight is an issue in our city to provide the historical context for this issue.
I appreciate that, but how do I compare that with the areas you've left out? I appreciate you're saying, Councillor, if I put it all on there, it'd be so tiny you wouldn't be able to read it. But there's got to be a way to include it all so it is legible. And I don't understand some of the neighborhood geographic descriptions you've given as well. I never heard of central/north lower. I just never have heard of that neighborhood or that district description, or east/north lower. So anyways, maybe that could be food for thought moving forward. Thanks, Mr. Deputy.
Thank you. Councillor Whitehead.
I want to re-emphasize me sitting back here representing the West Mountain and not seeing anything there. And I know that I got a cold red roasted neighbor, but it's a bit surprising that it's not being reflected here in any way. But as a council trying to make informed decisions, you like to see every part of the geographic area of the city defined in regards to statistical information being provided, one. And two, I thought we already had a standard in regards to identifying all areas of the city. It's called wards, so I'm a little concerned about the way you're breaking it down here. So I would prefer to have something that we understand.
Dr. Richardson's anxious to answer this.
Mr. Deputy Mayor, thank you. Yeah, as Jen has said, the point of the slide wasn't to provide data for the whole city. It was just to be illustrative of some of the stuff that we look at. The point of the slide wasn't to provide data for the whole city. It was meant to just be illustrative of some of the sorts of things that we look at. So I think the feedback I'm getting is next time we present data of this sort, it's better to present the whole city. So we'll go ahead and do that. We can come back to you with a presentation on low birth weight across the city if people would like. On the issue of the naming of it, the issue is that the data is broken down by postal code. So we originally had this all as the three first letters of a postal code, but didn't feel that that would be descriptive of people to understand it. We don't have this data right now broken down by ward per se because of those boundary issues. So I hear what you're saying about the way the data is presented. I think it would be really helpful though if we could, if there's a desire to have us come back and talk more about low birth weights, we can do that so people can understand the issues in their wards a little bit better. But it might be helpful, from the standpoint of what this particular orientation session is about, to look at the standards and how that is played out through the course of the work. It might be helpful for Jen to continue on with the presentation and then see if that sort of helps you to understand the context a little bit further.
Councillor White.
Well, back to any comparison. I mean, you've got different councillors here representing areas that love to have presentations, because this presentation isn't just for the benefit of the people sitting around this horseshoe, but it's certainly being live streamed for the benefit of the broader community. And when people from my ward are looking at it, say, well, okay, so what is the issue? Is it an issue in Ward 8? And it's been reflected that, at least on this format, it's not. And I don't think that's the case. So I would prefer a format. If you have to go to postal codes, because most of us do postal walks, we understand, LAC and LNN and all that, but it's got to be better defined than these sort of generic geographic areas that no one really understands. So I would appreciate some better format.
I think we beat poor Jen up enough on this one now, so let's go on to your next slide, Jen.
I'll just comment through you, Mr. Chair, that we really appreciate the feedback. And I do hear you. We have no problem presenting the data by FSA, and I will refer you back to the January 1st, 2004 report that does include all of that data, but we really are happy to come back to give those more specific details. So thank you for your comments. I'll just highlight the determinants of health, which I know was part of the April 1st Board of Health report. So you'll see in the center of this picture the determinants of health in the blue squares. In the purple squares, you'll see the purple squares really highlight the risk for low birth weight within our city. And it's rooted in the social determinants of health. So you can see the risks are much higher for women who already face social and economic disadvantage. These factors make it harder to access community supports, navigate the healthcare system, and make healthy lifestyle choices. Faced with chronic stress and limited opportunities, a woman with social disadvantage is more likely to use cigarettes, alcohol, or drugs. All of these stresses can add to low birth weight. An infant born at low birth weight faces risk of many long-term health problems that are much harder to manage in families that already face social and economic barriers. There are several modifiable risk factors that research and local data tell us we have the potential to influence. The Board of Health outcomes and requirements within the reproductive health standards shown on this slide direct us to work with community partners using a comprehensive approach to enhance supportive environments in our city and to impact reproductive health outcomes. Keeping the standards in mind, Public Health Services leads the work with community partners related to low birth weight through the Healthy Birth Weights Coalition. The coalition has worked together to build a strategy for collaborative action to enhance our capacity to address this issue. The community-wide coalition is made up of more than 50 members from 30 different organizations, from healthcare providers, community organizations, and researchers. The vision of the coalition is to strengthen our community by supporting healthy lives and healthy relationships for moms, babies, and neighborhoods. A collaborative approach is what is required to address the complex issues that contribute to the increased risk of low birth weight in our city. The Healthy Birth Weights Coalition is committed to taking a collaborative, community-driven approach to build on the strengths and priorities of Hamilton residents, in particular our young parents. We know it is critical that any strategies we develop be driven by the experience and voices of young parents themselves. We have 4 young parents, seen on this slide, working with us as community researchers. These 4 women have co-facilitated focus groups with 52 other young parents. Their experiences have been integral to directing our work and decisions. They help to map out barriers and recommendations to improve system of supports in our city. The young parents involved in the project, through research, storytelling, and video creation, are passionate about using their voices to tell the stories behind the statistics in order to motivate change. This is a short video clip from a 6-minute video called Restore Hope, Break Cycles, and Break Stigma that young parents in our city have created with the support of the coalition.
When I found out I was pregnant at 16, 13, I was 18.
17.
I turned 19, 18. When I found out I was pregnant, I was 16. I did not anticipate getting pregnant that soon. My mind was completely blank.
I was pretty scared.
I was really scared. I wasn't sure if I was ready to have a baby. I cried. I cried, actually. I dropped to the ground, falling my eyes out. Just really your life is about to change. Like, it's been big. Then again, it's just beginning. 2 of the big things I think that really helped me out was the maternity center and public health nurses. Not only do they help you take care of yourself, do checkups on you and your baby, but you also get a lot of knowledge. I went to St. Rose Care, which is a home for good mothers. They have housing, they have groups, they have meals, they have programs to help you reach out and learn who's in the community for you. Healthy Babies Health Insurance Program. I had a nurse that came to the house. I find that Living Rock is a really helpful place. I mean, you go there, you can have dinner. The Kingsway is amazing. It's a Christian place. After my son was born, I went to the Hamilton Regional Indian Center, and they were very helpful. They have art programs, cooking programs, parenting classes that I took. Go through college, get a job, do everything that you need to do for your child. Being a mom is the toughest job in the entire world, and no mom gets enough credit, and I can tell you that much.
just let you read that slide because I think it's pretty compelling and it speaks to the passion of our young parents. So the slide just says that this was a youth-inspired video created by and led by youth. And they really see this as a vehicle to have their voices heard. They have been inspiring in coming out with us in the community and sitting around the table with us with stakeholders and key community partners. And really, I think they've been the glue that's made us all move together on this coalition in addressing this issue. The next slide, I'll review the structure of the Healthy Birthways Coalition. So the coalition is central and acts as an advisory body. It's at the center. The three circles at the top represent 3 action teams or work group that include membership of the coalition to work on current prioritized projects. So you can see there, we've prioritized professional education action team, care pathway action team, and smoking cessation action groups. Both the coalition and each of the action groups have developed project charters and project plans that outline specific activities to help us reach our goals. The base of the diagram represents Public Health Services leadership and internal collaboration. Our project manager, Vanessa Parlett, who we've heard from today already, is with us and has been essential in leading this work and leveraging $235,000 in grant funds. Although Public Health Services has been integral in obtaining grants, the funds are administered through our coalition agencies to support services and activities to improve outcomes. The project plans include a comprehensive approach to reach and deal with the complex issue of low birth weight. They direct support at both individual and system levels in strengthening the integration and coordination of resources across our city. It is this approach that will allow us to impact the societal outcomes that is required by the Ontario Public Health Standards and to reduce low birth weight. It is our hope that this presentation provides some real-life application of the Ontario Public Health Standards and protocols to demonstrate what they look like in practice. We have provided a very high-level overview of this initiative. This overview does not begin to cover all the work that is happening with the Healthy Birth Weights Initiative. We've also not included many of the other programs and services that also support the achievement of the reproductive health standard. I'll just turn it over to Jen to talk to the last slide.
So that concludes your 4th orientation session. We have one more to go, which will be at next month's Board of Health meeting in May, and that will cover the Ontario Public Health Organizational Standards. So thank you again for having Jen and I here today, and we'd like to invite any other questions that you may have.
Well, thank you, Jennifer and Jen. Are you both Jens? Works for me.
Works.
It's easy to remember the name then. Councillor Green.
Thank you very much, Mr. Deputy Mayor, and I really appreciate the presentation. I've heard it said by public health officials and community developers that the health of our mothers are really indicative of the health of our communities as a whole. So this birth weight series, and really appreciating the data you've presented, because it tells us kind of where we're at, and it certainly creates a standard, particularly where some of our higher impact areas are. So really looking forward to seeing more of this work, and I can appreciate my council colleagues' concerns around finding out fuller information. Through you, Mr. Deputy Mayor, as a question, is data that is more pinpointed, because I know in Ward 3, for instance, Mr. Deputy Mayor, through you, that you can have literally, one block be a stark difference in terms of postal code to another block. And so can you just maybe expand on the importance of being able to pinpoint data as a way of finding out what are some of the determinants? Jen?
Through you, Mr. Deputy Mayor, I think it's important to look at data at a whole bunch of different levels, and that really is what drives our strategies and activities in public health. We need to have a sense of what's happening in the city as a whole and look at population trends in order to determine our areas of focus and the first steps that we need to take, it's important to look at data at a lower level, which can sometimes be at the neighborhood level, and it can sometimes be related to a particular health issue. So it's these both sets of data in combination with research and the voice of our community who are living the experience that helps to direct the strategy. So to answer your question, it's really important that we're never only looking at one thing to drive our strategies, but that it's a comprehensive approach, because the issue is so complex. If we only ever tackle it one issue at a time, we'll make very limited progress.
Certainly can appreciate the complexity of the challenges, particularly as it relates to issues like poverty and environment. So I do appreciate that and certainly look forward to following this along. My hope, Mr. Deputy Mayor, is that 4 years down the line, we can revisit this orientation and see that somehow, through some of our local strategies and our local policies and local investments, that we've been able to move the needle a little bit on this. So thank you very much for the presentation.
Thank you. Councillor Whitehead.
Thank you. I know Councillor Green wasn't here when this whole discussion started. But I recall when, long before I was a councillor, I was working in the North End with the North End Community Clinic, Master University, who has done a lot of work in compiling data, as well as St. Joe's Hospital to look at programs, identify clusters, and I think the three key areas was environment, nutrition, and genetic. Am I missing a category there?
Yeah, as I said, the low birth weight issue is complex and it's rooted in the social determinants of health. Just looking at our local data and how it maps, we're highlighting smoking during pregnancy and teen pregnancy as two modifiable risk factors to start to tackle the issue and engage in some particular strategies. There is certainly evidence to say that maternal weight gain during pregnancy is an important predictor of healthy birth weights for children. So you're right in identifying that there are other issues that contribute to low birth weight, which will be part of our multi-year strategy moving forward.
Okay, so I guess I'm trying to understand the breakdown, because I raised this before, and I came from a household, I was a twin. And I was a smoking household, and I came from a community in which I talked to the doctor who delivered both the babies, and it was a high smoking community in Northern Ontario, and I can tell you that it was just the opposite. It was not an issue of low birth weight babies in that community by any stretch of imagination, and Dr. McMillan attested to that. So the question becomes, there are other factors here too that play into low birth weight babies, and I'm not suggesting that what you're doing is a good thing, it's a great thing. But there are other issues around nutrition and possibly even genetics is what was raised by, in the past by Mac even. So I'm trying to understand what role and how much of that is being dealt with to better understand this issue.
Through you, Mr. Chair, I think what we're doing, or I know what we're doing, is we're addressing the issues that are most prominent in our city right now. And that has to do with smoking and teen pregnancy. And I appreciate that that wasn't your experience in terms of weight gain. But we do know what the trends indicate, and certainly our local data indicates smoking during pregnancy does directly impact the birth weight of children, and it is a modifiable risk factor that we have the potential to influence.
And I appreciate that. I think the example I used was a whole community where there wasn't any unemployment. It was good high wages, so people weren't starving. There was no poverty. But certainly at that era, in the early 50s, smoking was a predominant thing in small isolated communities, and yet the evidence didn't bear out in regards to low birth weight babies. So it's always been a challenge for me to accept that that is the only cause, although it is an issue. I just don't want to ignore the other side of this, and that is the nutrition side.
Yeah, thank you, through you, Mr. Chair. I appreciate those comments, because what I hear you saying, I think, is that it's a complex issue and you're recognizing how the social determinants of health interplay with one another to impact the health of our community.
Yes, thank you.
Councillor Khan.
You talked about goals that you're trying to obtain, but how do you know when you reach these goals? Is it every year you do another comparator, or over 5 years, or how do you know if you're really, the weights are getting better, for instance?
Yeah, I think that's an excellent question through you, Mr. Chair. We do monitor our data on an ongoing basis to see what's happening with our smoking rates and our low birth weight rates in the City of Hamilton. In addition to that, you identified or questioned or asked about the goals. We do have a whole list of goals. Again, we'd be happy to share these with you with an information report, but the goals are really specific. And so we have process goals, which talk about the collaboration that needs to happen with our partners in order to achieve this. Outcome goals, which identify targets for smoking rates that we're hoping to achieve with pregnant women. And societal goals, which has the long-range plans of looking at our low birth weight rates across our population over the long run.
Yeah, I know you have the goals, and they're good goals. I just don't know how you evaluate the goals. You say every July 1st, you compare all your stats for the year and see if we're going up and down or sideways. Is that how you do it? So you can have a black and white comparison?
Yeah, through you, Mr. Chair. Yes, we do monitor our stats quarterly. And in-house in Public Health Services, we have applied research and evaluation that provides those stats to us so that we can look at them. In relation to healthy birth weights, we have set some targets for December of each year to give us an opportunity to go back to the targets we set as a coalition to see how we're doing and to see if we're impacting change. We're doing really well in terms of our process outcomes. This summer, we're just about to pilot a care pathway, which works towards system integration in our city, and we'll be piloting at the MAT Center. So we'll be monitoring our targets closer to December when we see that rolling across the city.
Thank you. And low birth weight, some of that is hereditary, isn't it? You just, parents or the mother always has low birth weight. I mean, I've got 2 grandsons, they're less than 5 pounds, both of them, and they're perfectly healthy, and nothing wrong with them, and they don't smoke, and there's nothing in there that would trigger anything. I think they're normal for her, but is that incorporated, or you just want to, you know?
Through you, Mr. Chair, I think it's hard to answer that question because you're right, small people tend to make small babies and big people tend to make big babies, and we certainly base the definition of low birth weight as a medical definition, and there's a criteria. So it's based on the trends, considering weights and averages of families. So there are multiple things that you look at when we're considering low birth weight babies. Is it a term baby? How is the child doing growth and developmentally? So I'm happy to hear that your grandchildren are healthy.
Thank you. Thank you.
Thank you, and I have no more questions, so thank you very much, Jim, for the presentation. It was obviously very informative because it stimulated a lot of questions. So motion to receive, moved by Councilor Pearson, seconded by Councilor Green, all in favor?
Just put your hand up. Hi, did you perform for that? You just gotta put your hand up.
So all in favor? Carried. We'll now move on to item 8.1, and is there any discussion regarding 8.1? Councilor Green.
This is the report.
Yes, it's on the report rules and it's the information.
Certainly lots of questions I have on this one. I don't know if staff will be available to answer them, or if we'll be having a presentation on their findings.
A presentation
on their findings at all? Is there a presentation on their findings, or somebody that would like to start first?
Mr. Deputy Mayor, no, we weren't planning to do a presentation. There was a presentation that occurred at GIC and then just some information.
Okay, I do have some questions, and I hope you will indulge me. You are seated, so it might be like you're up here. So through you, Mr. Deputy Mayor.
Would you like Dr. Richardson to come to the podium?
I don't know if that's, I do feel a little bit rude with my back to her, but.
I think she's okay with that.
You're okay? You don't have to see me? Okay, that's fair. So, through you, Mr. Deputy Mayor, to Dr. Richardson. I do have a couple of thoughts on this report. I did get a chance to read it, and do thank you for the nature and the variety of eyes that you've had on this. But I do have some questions because there are some inconsistencies based on the reports that we had last week. So the first question is, can you confirm that this public health report is based off of self-reported data as provided to you from Conestoga Rovers Associates on behalf of Port Fuels and Materials Incorporated? Is that correct?
Through you, Mr. Deputy Mayor, I'm going to ask Jessica Hopkins. She's the Associate Medical Officer for Mr. Pittsburgh.
Yeah, get right up against the microphone.
So through you to the appropriate staff.
I think I heard the question, so I think they have an answer for it.
Yeah, so through the Deputy Mayor, some of the data that you will see in the report, which especially in areas where it says a date of personal communication, so we described the process where we met with the proponent as well as with Conestoga Rovers to produce the proponent's report. In order to do that, I believe Mr. Pickfield, the external legal counsel, discussed this at GIC. We had to sign a non-disclosure agreement in order to review certain information. And so some of the information that's included in this, we are not able to describe in further details because of the non-disclosure agreement we needed to sign.
I can appreciate that answer through you, Mr. Deputy Mayor. However, there are points where I want to make a clear distinction between what has been withheld through a non-disclosure and what has just been voluntarily withheld regarding this process. So can you confirm for the sake of the public that the areas of concern based on reviews of the Public Health Board of Hamilton and Ontario, as well as Golder & Associates, are as follows? That the conclusions from the Human Health Risk Assessment are based on the air quality assessment, and as one is drawn from the other, the deficiencies identified in the AQA negatively impact the confidence in the accuracy and validity of the HHRA, of the Human Health Risk Assessment.
So through the Deputy Mayor, you're quoting from the report, so yes, this is the Human Health Risk Assessment relies on the data that is in the Air Quality Assessment report. So any limitations that are in that data would also result in limitations in the conclusions drawn from the data.
Because I am saying this, that we have the fortune in these public health board meetings to provide additional information to the public who may or may not have access to these reports, and so I will be going through some of this stuff point by point, so please bear with me. So further, the proponent did not assess the unintentional potential health equity impacts on the local community, and that is your recommendation that a health equity impact assessment would further contribute to a better understanding of how this project could disproportionately disadvantage the health of certain groups in Hamilton residents. Is that correct?
So through the Deputy Mayor, as the report describes, Public Health is recommending that the proponent undertake a health equity impact assessment.
So it's an interesting carryover, Mr. Deputy Mayor, through you to the staff, that given the presentation we just had around some of these key determinants of health, that this could be a vital key link from a data perspective to be able to really understand the precautionary principle of this type of endeavor. Through you, Mr. Deputy Mayor, is that fair to say, staff? That there could be linkages here of key determinants of health without such an analysis?
So through the Deputy Mayor, a health equity impact assessment will help us to better understand any unintentional impacts, both positive and negative, that could result from this proposal.
None of which that were included in this current study, is that correct?
So through the Deputy Mayor, the current environmental screening report that was produced by the proponent did not include a health equity impact assessment.
Okay, thank you. And under Section A, which is the baseline and existing conditions in the Appendix A, Board of Health, Report 15012, that the waste is accepted, is material processed as refuse-derived fuel, RDF. Can you please clarify how this process for preparing the RDF waste fuel was taken into account of your overall assessment and findings of this report? For example, how far did your consultants and experts drill down on the waste receiving, storage preparation, and overall intake process?
So through the Deputy Mayor, the consultants reviewed the information that was provided to them through the environmental screening report by Conestoga Rovers, the consultants for the proponent. In terms of going in further to it, there was discussion at some of the meetings that followed as a result of the concerns that we had, that we shared with the proponent. However, I don't believe I can go into detail because some of those are covered by the non-disclosure agreement.
So are you stating then, for the public record and just for clarity, that part of the non-disclosure withholds information from the public record how this is going to be handled, processed, and stored? Is that correct?
Through the Deputy Mayor, I believe that you, and I apologize if I misunderstood, I believe you were asking me about some of the sources around where the waste is coming from, and that is certainly covered through the non-disclosure agreement. In terms of the, I'm sorry, can you repeat the second part? There was storage and...
Correct. I'll be very meticulous with this. These are all important points for the public record based on the findings of the Public Health Board. Can you please clarify how the process for preparing refuse-derived fuel, RDF, waste fuel, was taken into account for your overall public health assessment in finding of this report? For example, how far did your consultants and experts drill down on the waste receiving, storage, preparation, and overall intake process? And for a second, just so that we're clear, I'm not talking about the source materials. I'm speaking directly to how they are taken in, processed, and stored. These are all very important pieces, I think, for an overall public health conversation. Doctor?
So through the Deputy Mayor, in terms of receiving, storage, preparation, and intake process, the consultants we hired reviewed the environmental screening report and had discussions with the proponent on these issues.
So is the answer yes?
No, without leading the staff, I think the question is...
We're just trying to get to an answer, so we...
Through you to staff, I'm not. I appreciate the fact that this is an important topic. We have a report in front of us that have key findings. I want to be very clear on the information used to come to these conclusions. And so my question is that inside of the disclosure, or was it not reported how this imaginary RDF, they call it RDF, refuse-derived fuel, will be taken into account for your overall assessment? For example, how far did you go down into the waste receiving, storage, preparation, and overall intake process?
So through the Deputy Mayor, I think one of the reasons that it's challenging for me to answer that question is some of the technologies that we discussed in the meetings are covered by the non-disclosure agreement. And so the consultants did discuss these things. However, some of it is covered by the non-disclosure agreement.
So some was discussed. And if there's any need for us to go in camera, I'm happy to do that as well. These are very important points. I will move on to the next question. As I understand, you are put in a position where there's been some information withheld, perhaps, as I'm hearing, and some information that has been discussed, but under the non-disclosure agreement. So I'm happy to move on to points that I have under Section D, which is the gas engine exhaust. The stack testing is from the pilot plant in Swindon, is that correct? Section D.
Deputy Mayor, yes, the information is from the pilot site in Swindon, UK.
So point 19 states the size of the pilot engine, the load on the engine, and the consumption rate of the syngas are not reported or not provided in reports. Why do you think that is?
Through the Deputy Mayor, I can't comment on why the proponent would not decide to share certain information if they have it.
So regarding section D, gas engine exhaust, very important to an overall public health conversation, you are stating and confirming that in fact they have not reported on the size of the engine, the load of the engine, or the consumption rate of syngas. It's not in any of the reports.
Through the Deputy Mayor, I would have to go through the reports again in detail, but at this offhand, I do not believe that we have that detailed information.
If you turn to section, Mr. Deputy Mayor, I'm not begging the question, but just for the point of clarity, if you turn to section D, under gas engine exhaust, under the report 15012, under section 19, this is a statement from your report that none of this information has been provided. I just want that clarified for the public record.
Deputy Mayor, can you just tell me which section it is again?
Section D, Appendix A,
Yep.
15012. Section D, 19. These are key questions, Mr. Deputy Mayor, regarding the accuracy and deficiencies of reports that are in fact self-reported. We have this trouble with clarity. It seems that last week's meeting, Mr. Deputy Mayor, has caused me to look at both of these reports and see some serious inconsistencies, and I want them all in the public record this afternoon.
So through the Deputy Mayor, so for Appendix A, Section D, subsection 19, as the report describes, we do not have the
size
more
of
detailed information on the engine.
Detailed information being the size, the load, and the consumption rate not reported, all very important. So now that we're on that page and we're all together, under section F, which is the air dispersion modeling, or the AERMOD as it's referred to in scientific terms, point 35, that is unclear how this dispersion model was executed, as the electronic files or copies of the inputs were not provided, nor were they online. Is that correct?
Through the Deputy Mayor, that is correct. Those electronic files were not provided to our consultant.
So it's not that they were, as a part of some non-disclosure agreement, they were just not provided for the sake of the public record. Is that correct?
The Deputy Mayor, our consultant had discussions with the proponent. I would have to go back and check with our consultant if they were eventually shared under the non-disclosure agreement or not.
Very important question, because we're using these air dispersion models, Mr. Deputy Mayor, to create findings that are presented in a public health report. It is very important to know that we actually have seen these data sets and that we've had an opportunity to understand how they've come to the conclusions that they're self-reporting on. So my question through you, Mr. Deputy Mayor, to the staff, how is that acceptable? And are we simply supposed to take their word for it as self-reporting?
So through the Deputy Mayor, I am not an air quality modeling expert, and I would need to speak to our consultant in further detail. However, if I can speak more generally to modeling, when you are evaluating as part of a peer review process a model, you can look at a model, and the AirMod model is a standard type model. One does not always need to look at the detailed individual data lines in order to evaluate that model per se. So it's quite a complex process, and our consultant had discussions with their consultants.
So, Mr. Deputy Mayor, then is it fair to say that this air disbursement model is a guess, or a best guess, a hypothetical guess, given that there has not been any actual empirical data provided?
So in terms of what our consultant was able to review, in the environmental screening report, the information around how the modeling was conducted was shared. To my knowledge, the exact data set was not shared. However, this would not be an unusual practice during a peer review because you don't generally rerun an entire model. You just review the process.
That's fair. I'll accept that. Thank you. Now on to the Public Health Ontario scientific and technical advice as included in Appendix B to the report BOH 15012. Just to, for the public record, Mr. Deputy Mayor, reiterate that the HHRERA, the Human Health Risk Assessment, does not quantitatively or qualitatively discuss emissions from waste delivery trucks to and from the proposed facility. Is that correct? This is under Appendix B.
What section of Appendix B?
I will go to pages.
So through the Deputy Mayor, sorry, I was just consulting with my colleagues because at the time that this report was produced and shared with the Board of Health, we did not have that information. Since that point in time, we have had further discussions with the proponent, and they have rerun the models that includes that information.
Well, Mr. Deputy Mayor, here's where I'm having a problem with the integrity of things that are being said around this project. Last week, we had these proponents come in here in front of our council and talk about roughly 130 truck activities to be determined as roughly 65 round trips to and from. It was a question that was brought up by my councillor colleague, Brenda Johnson. This was something we discussed, and Councillor Whitehead. Very pointed questions. They stood here, Mr. Deputy Mayor, in front of council on the public record, made that assertion. However, specifically, as identified by Boulder and Associates in Appendix E, Section 2, that the proponents indicated that they would receive 85 trucks per day. 85 trucks, 48 large and 37 small. But Section 8.1 of the Design and Operations Report, Mr. Deputy Mayor, suggests that the project will receive somewhere between 30 and 115 waste trucks a day. And in this report as provided by the Public Board of Health, by our own staff, it is unclear how 85 trucks a day were derived as the tonnage indicated in Section 8.1 does not seem to be accounted for. So Mr. Deputy Mayor, I'm having some serious questions about their ability for basic math based on the tonnage that they're proposing for this plant and the amount of truck traffic that they're claiming self-reported here at council, as well as the inconsistencies that they're reporting to the Board of Health, as well as to their applications to the to the province. So in addition, I should note that these proponents led us to believe there'd only be 130 movements per day or 65 trips per day. Why are they so inconsistent with the reporting? They've even gone so far, Mr. Deputy Mayor, as to mislead us by self-reporting in this report that we have before us, that they will be sourcing this from a 5-kilometer radius, Mr. Deputy Mayor. Yet just last week, they were very clear in their obvious reluctance to publicly recommit to this claim. So Mr. Deputy Mayor, and through you to the Public Board of Health staff, I do respect the variety of opinions that are presented in this report, this information report. However, given that all the seemingly important data, the empirical evidence, Mr. Deputy Mayor, has been omitted from this self-reported process, how is it that the Board of Health, in its opening findings, through you to staff, can conclude that this is a promising, innovative technology, given that there is no empirical data, or at least important empirical data, missing from this report to conclude? And I will say that, Mr. Deputy Mayor, this is a question I have through you to staff. Given all these gaps in empirical evidence-based research and all the information that's missing from this report, how can these findings in the opening paragraph come to the conclusion, objectively, that this is innovative technology when in fact there is no, or at least very little, empirical evidence-based data to conclude such a statement?
So through the Deputy Mayor, the one thing I want to be clear about is that the next steps for this are for the Board of Health, the Medical Officer of Health, to send a letter to the MOC ECC Director to describe some of our concerns, because as we outlined in the report, there are some concerns associated with this project, so that the Director can determine a process for that as to be resolved. When we were preparing this report, we looked at both the positive and negatives of the proposed project. And the paragraph that you described is not the conclusion of the report, but it is an acknowledgement of some of the positive aspects of this project that we found as we investigated it. And that includes, for example, low, and we've been told no carbon dioxide emissions. Carbon dioxide, as you know, is a very important greenhouse gas. Climate change is very important to public health. And so there are aspects of this project which are potentially positive, and all of these need to be weighed in terms of public health. And so we have acknowledged those, but that is not the conclusion of the report. The report, in terms of its conclusion, is really to send that letter to the MOECC, which is through the normal regulatory process, which will allow for the Director at the Ministry of Environment and Climate Change to determine a process to address some of the outstanding public health concerns.
Mr. Deputy Mayor, through you to staff, I can appreciate that as a position. I would like to however, offer to staff that in their findings in the report that they consider using the term hypothetical or possible advantages or possible innovation or hypothetical innovation or self-reported innovation. All of those terms, I think, underscore the underlying inconsistencies with reporting. And I say that, Mr. Deputy Mayor, because I believe that especially this committee, of all committees, given the precautionary nature of public health, that we need to have caution when confusing the word innovation with unproven experimental models, clearly lacking critical empirical data to back their claims. And I will leave it on that, and thank you, Mr. Deputy Mayor and members of council, for allowing these very critical issues to be put back on the public record as a response to this key finding report. Thank you, Mr. Deputy Mayor. I have no further statements or questions.
Thank you. There were very tough but respectful questions. So I have no other speakers, so I simply need a motion to, Councillor White.
Can I just ask the public health, the non-disclosure agreement means that you had access to information that you can assess, but you can't disclose the nature of that information, is that correct?
Through the Deputy Mayor, that is correct. We signed an agreement where we could have access to information, both written and verbal, that was shared by the proponent as well as the consultants for the proponent. However, we are not able to share that information publicly.
So can we, as the Board of Health, get a copy of what was agreed to in regards to that information that they are disclosing, not the specifics, but the categories?
Through the Deputy Mayor, we can share the non-disclosure agreement so that you can understand the nature of what we entered into. I would need to consult with Mr. Pickfield from legal counsel in order to understand what information could be shared with the Board of Health so that we do not, so that we adhere to the non-disclosure agreement.
And I'm not asking to breach that in any way. What I'm asking is for us to be clear what fell under the non-disclosure, and then what falls outside the non-disclosure, and then we can itemize. So I'm not looking for the specifics in regards to compromising the competitive nature of the operation. I am looking for the categories.
I heard staff say they can get you a copy of the non-disclosure agreement. Would that satisfy your concerns?
If it has that breakdown, yes.
Through the Deputy Mayor, why don't we provide a copy of the non-disclosure agreement, and then if that does not satisfy what you're looking for, we can consult further with Mr. Pickfield and determine how much more information we can provide to you.
I appreciate that. The next question is...
Just one second, Councillor, you want to have a clarification of something on that issue?
I appreciate that, Mr. Deputy Mayor. It should be noted to members of council that this report is actually fairly clear and obvious where they have decided not to provide information. It's in as I've annotated in all of my events where they have not refused, where they have refused to provide information. So that has been noted in the report, and I do appreciate staff for making those notes.
But they have refused publicly to do it, but our staff have an opportunity to view it, correct?
In this report, it says information has not been provided. It does not clarify that it was provided inside a non-disclosure agreement, Mr. Deputy Mayor.
So just for clarification to staff, then, you have seen this information, but you can't talk about it under the non-disclosure agreement?
Through the Deputy Mayor, there's a mixture of both
Okay.
inside the various consultant reports as well as our Board of Health report. So there is both information that is under the non-disclosure agreement, so we're not able to share because of that. However, there's also information which may potentially be there that the proponent has not shared with us.
Okay, so Councilor White, to the floor. And just for the information of members of council, we will lose quorum in 10 minutes. So we need to move this along.
Thank you.
Councilor White.
So the next question was the data question is over and above what's contained in the non-disclosure. I'd like to see it, I think it might be contained here, but I'd like to see it in a very factual white list of what questions or information we requested that they wouldn't provide outside the disclosure agreement. So we have a clear picture of the cooperation we're receiving in doing these analysis and assessment. And the last piece, Mr. Chair, is that it's always sort of been foggy for me in how peer review works and how modeling works. And I feel like I'm operating from a point of ignorance. And I think might be helpful to have a workshop to understand the approach we take when we do peer review, because I don't want to be overly critical if I don't clearly understand that process. So I ask maybe to staff if that's possible to have a workshop.
Yes, through the Deputy Mayor, we'd be happy to provide something to Board of Health of that nature.
Thank you.
Councilor Johnson.
Thanks. And Mr. Deputy Mayor, I know we do have to hustle a bit, so I'll try to be as brief as possible. I have a question about the HEIA step you've recommended as a future step. And sorry, and I'm doing that acronym correctly, right? It's not HIAP or something. It's, yeah, HEIA. And this actually relates to something Councillor Whitehead was just talking about. I have a concern about our government reports and findings on the gas plant relying excessively on information given to us from Port Fuels Corporation itself. Simply because it is clear that Port Fuels has a financial interest in presenting the data in whatever way is legal, in a way that is nonetheless, while legal and not lying per se, skewed toward the conclusion that the Port Fuels Corporation activities, proposed activities, are safe and beneficial. So to kind of narrow my concern down into a question, could you advise about whether the steps of the HEIA process take into account that concern, and how do they do that?
Thank you for the question. Through the Deputy Mayor. So I'll just back up for a minute and speak just briefly about a peer review process. We'll do something more detailed later on. But this is very similar to the kinds of work that, for example, I do when I'm peer reviewing journal articles that people are submitting for publication in the scientific literature. And when you go and peer review someone else's work, you don't have access to their raw data. So what you do is you actually look at a couple of different things. One is called internal validity. And what that means is you have a look at the process and the methods that someone used in order to analyze their data to understand what are the strengths and what are the limitations. The next thing that you do is you evaluate the external validity or the generalizability. What does this actually mean in the context in which we're speaking? So for a project like this, what does this actually mean in the location that the proponent is proposing for this to go in Hamilton? And that's the process that occurs with a peer review. So what our consultants do is they don't necessarily have the raw data, so the line-by-line numbers of every single reading in all cases. However, they're able to look at the process that are used, and they're generally accepted scientific methodologies for how you analyze things. So they will analyze those. To go to what you were really asking about, the HEIA, so the Health Equity Impact Assessment is not intended to go through that entire process. It actually looks at something that's not covered in what the proponent has done so far. And that looks at the distribution of unintentional health consequences, both positive and negative, in the community. And so to try to explain this a little bit more clearly, what that means is we know there are certain neighborhoods in Hamilton, for example, that have higher levels of diseases or higher levels of emergency department room visits. And what a health equity impact assessment does is it allows you to analyze and understand the data that you have, the potential that it could have for positive and negative changes to the different distribution of health across the communities that will be impacted. And it can also help you to understand if there's any monitoring that needs to occur in the future.
Thanks.
Okay, and Councilor Brewer, final speaker.
Thank you, Mr. Chairman. Mr. Chairman, two things that I want to highlight. And, I've been somewhat consistent, and the proponents have advised us publicly that consistently that they're willing to accept. And I know you've mentioned or alluded to it in the Operation Upset scenario model with respect to the air pollution controls and what if there's a malfunction of some kind. Now, just to clarify, and perhaps I need to bring forward a motion, but the intent of what I spoke to him about, Mr. Clark, was that it would be 24/7 real-time monitoring, but not of a third party, but of our public health department. So through you, Mr. Chairman, I think we might need to amend this to make this very clear that the intent of that and what he agreed to assess was that we as a city, as a public health department, would be responsible for the 24/7 monitoring of that particular mission. So through you, can I have some understanding of where you stand on that issue?
Who's your question to?
To whoever that answer.
Through you, Mr. Deputy Mayor, Deputy Chairman, I'll take the first shot at this. So I think last week what we heard was that the proponents had said that their stacks and their equipment will all be monitored 24/7. I think one of the things that we can do as a public health department is make recommendations to the Ministry of Environment and Climate Change. Should it come to the environmental certificate of approval stage, where those types of things can be included in an environmental certificate of approval that says that they have to provide a higher level of monitoring than that which is proposed right at the stacks or right at the site. So it could be the point of impingement modeling, or it could be other models or other testing equipment that we already have in place in the city that we could use to actually monitor on a real-time basis through the Hammond network. So I think it's all achievable. The question is who should do it and at what cost in my mind.
So this is the bottom line. So, and this was confusing last week. The intent of what I mentioned to him, what he agreed to, was that it would be site-specific monitoring of that actual stack itself. Because they've said, Mr. Chairman, that they're confident that what's being emitted is not going to pose any problem to our community from an environmental perspective. Hence, with that confidence, should come acceptance for it to be monitored by not from a voluntary basis from a third party non-government agency, but from the city and our public health department paid for by the corporation itself. So, at the appropriate time, I want to amend it or move that we amend it to clarify that position, because there was some sort of confusion, but he understood exactly, and subsequent to that, I had communications with some of their people who I clearly illustrated that that was the intent, and they said that's fine, they will assess it. So he said it last week, and he said it last year, that he's willing to assess it, and we need to have that clarity. So I will move that presence that it is highlighted.
Can I suggest, Councilman, I'd like to produce a quorum in 3 minutes, and we probably need city legal department here too, that you would bring this motion forward at a future GIC. Dr. Richardson will be there. The solicitor will be there. And then we'll have time. We're not running out of time.
I have no problem with that. So I will put it forward as a notice. Through you, Mr. Chairman. Chairman, it's not time sensitive, so this is only an information item. So hence I will have the time to do that. It won't in any way interfere with that definition. So I have no problem, so I'll do that. Because I'll declare that as a notice for a future public health meeting as opposed to JC.
And if we can arrange, then the Dr. Richardson have Janice here for that.
That's fine. And secondly, with respect to importing of actual garbage, he was hesitant to actually confirm without any doubt that it was kind of a little unusual. He said that he was willing, that they were asking for permission to import garbage, but yet they're not planning on importing garbage. I simply want them to commit in writing that they're not going to import garbage. And that's what I said to their proponents as well. I'm not sure what, unless they're playing some game, why are they not willing to just simply say, we're not importing garbage and put it in writing? So if we can somehow tie that in to that motion as well, then we really appreciate it. So,
to ask the proponent to confirm that in writing to us would be your motion.
Yeah.
Okay, so I see no more questions. So in the interest of time, I know Councillor Benedict, we have to get away. So a motion to receive then. Moved by Conley, second by Pearson. All in favor, carried. Is there any motion? I have no motions. Is there any notices of motions other than Councillor Ruas? Any general information or other business? If not, a motion to adjourn. Go ahead. Johnson, all